I'm Colin 57 years old. I had prostate cancer. It started off, I had no symptoms, zero symptoms, which may surprise some people. My wife persuaded me to go for just a general health check. She had been trying to get me to do this for quite some time. Probably like most men, I didn't. Eventually she booked it. 2 days later I get the results and everything's great. It's all green and amber and red, and everything was green apart from one reading, which was PSA, which I didn't even know what PSA was at that point. The doctor then referred me to a urologist, then sent me for an MRI, which the follow-up from that was there was an area which he was uncertain of, which he then decided to do a biopsy. The result of the biopsy was that I had prostate cancer. We had time, which I think sometimes is good to know. I'd actually had a meeting with one of the surgeons and gone through all of the procedure of removal. I decided I wanted to do something about it, not just sort of sit and keep an eye on it. When I met Dr. Rana, he showed me the statistics, right? I'm an engineer by background, right? Maths is a big thing for me. He put up graphs on the computer and went through all the graphs and showed me the recovery rate, side effects against various different other treatments, and how this was a better way of doing it, and was probably the thing for me that made me most comfortable. Went home that afternoon actually, my wife and I made the decision very quickly. You know, let's do this, got booked in, and I couldn't fault it actually. I mean, I was in the morning and out in the afternoon. The thing that comes out of this, and I've said this to all my friends, and all my friends have been checked now, is that men don't get checked, right? And I was a classic in that space, right? If it was not for my wife, I would have waited till I got symptoms, and if I'd had symptoms, it might have been stage 2, it might have been stage 3, it might have been a different conversation that we're having right now. And it's so simple to get checked. It's so simple, a blood test. It's that world of like, I can't believe I never did this before, right? It's that, you know, so I encourage all my friends now to go and do the health check, and the PSA is part of it. I'd just like to thank Dr. Rana and City Hospital for everything. All the treatment has been fantastic. All of the staff have been first class. Everything's gone well for me, so I'm super happy.
I'm Dr. Rana, and I have a specialist interest in treating prostate cancers, especially with brachytherapy over more than a decade. It was so lovely to meet Colin and his wife. As I had trained in Scotland, he was already very well informed and educated by trade engineer who could understand old data and was able to make a decision about what I always considered is perhaps the best option for radically treating prostate cancer and curing it. And I'm very happy that everything went exactly as planned. When we saw his blood results after the treatment, that number has already halved, which means the treatment has really worked very well and there are no significant side effects, and that is what we discussed prior to the treatment. We want to talk about prostate cancer in UAE, where the national data will suggest that this is the third commonest cancer in men, topped by colorectal cancers and skin cancers. Prostate cancer can be diagnosed very easily. Blood test to diagnose prostate cancer is a simple PSA test, which nowadays in most health packages is included. The only thing men have to do is to just go for health screening, at least on an annual basis. And of course, if they had any family history or if they had any symptoms, they should definitely go on and check their PSA and talk to the urology consultants. We will expect that if the PSA testing was performed as a regular surveillance, more cancers you will see will be in an early stage where cure can be achieved. Unfortunately, unlike the European practice, still a significant number of patients we see in our clinics have got advanced prostate cancers. The good news is that the numbers are declining. I reviewed the data from 20 years ago. There used to be 3/4 of people will come to your clinic as an advanced cancer, and now it is 1/4, which is still very high. These cancers are curable. They can be cured with either removing with radical surgery or a long course of radiotherapy with daily attendance to the department. In suitable patients, you can insert radiotherapy directly into the prostate, and that is called brachytherapy. Mediclinic City Hospital invested to build the first service of prostate brachytherapy in UAE. We did that with the vision that people from this country don't have to travel far off places and abroad to get a very effective, least toxic treatment to cure their prostate cancer, where the recovery times are very quick. It's a day procedure, and there is no hospital admissions required. There is no blood loss. There are no cuts. There is no daily attendance for a couple of months, and the side effects are minimal. And yet you achieve the same level of cure as with a radical surgery. And I'm very happy to say that that is what Colin has undergone, and that is what he has achieved. And I wish more men out there will spread this message to get their PSA checked, and then if they have prostate cancer, consider prostate brachytherapy as one of the options without just going through the reflex decision as most surgeons will do. On behalf of my urology colleagues, brachytherapy team, and radiation oncology consultant colleagues, Dr. Mariam and Dr. Patricia, I would like to thank Colin and his family for trusting us with the care we provided for his cancer.